Welcome back, guys. Special one today. Kobe, after suffering the IVDD and having emergency surgery, this is a special one. I don't think you'll want to miss this. So Kobe's IVDD was graded as a 4. That means that he'd lost all use of his limbs below where the disc had prolapsed, yet he did still retain some deep pain sensation, which was a little bit encouraging, although it still wasn't a great situation. Where Kobe's disc had moved backwards and was touching upon the cord and the nerves coming out to the side, Kobe wasn't able to get the messages from his brain through the area of his back and down to his limbs like he needed, which is why he was getting the symptoms.
This way. This way.
Highlighted here in yellow is where Kobe had his injury, and what that means is from that point in the spine downwards, all the nerves could, in theory, be affected, and that's what we saw with Kobe with his paralysis.
Hey, he's running.
Laser was an ever-present in Kobe's treatment, fantastic for reducing inflammation, modulating pain, and because it is quite quiet and the dogs don't really feel it, they're really happy to have this done on them.
Honestly, I asked him, I said, no, he's walked up with this. I said, you're just not happy with the answer. I said, you're not going to tell you any different.
As treatment continued, I was using an instrument to assist me with Kobe's treatment. This was allowing me to work on not only the scar itself, but also the ligaments in and around Kobe's spine and some of the muscles and joints too, which would give him a lot of relief and allow me to be quite specific in areas I was working on. We did a lot of nerve stimulation with Kobe, especially in the latter half of his treatments. We did vibration, we did soft and sharp, we did a lot of placing, work around his pads, all of his peripheral joints, some hot and cold also. All of these were designed to stimulate Kobe's nerves, to make them work, to make the messages get from his brain to his legs, from his legs back up through his back to his brain, so everything was working together and we were stimulating. Just to try and get Kobe's nerves working again. You kiss me now with lip gloss, so I'll have So here you'll see me measuring Kobe's legs. I'm doing this to literally measure how much muscle mass there is on Kobe's thighs. You'll actually be really pleased to know that there was over 0.5 centimetre, nearly 3/4 centimetre more than when we started, which is showing that the muscle development is there and Kobe's leg muscles are coming back. Treatment continued with a lot of joint mobilizations for Kobe as he was starting to move around. His joints in his back end and his back legs were getting very stiff as they were being used in ways they hadn't been used for quite a while. Also, the proprioceptive input we had from mobilizing and moving his joints was invaluable.
That's what I've noticed as well, the pad.
Kobe was making amazing progress with every week that passed. The rehab was being increased, the treatment was being maintained, and Kobe was doing us proud, doing everything that he should have been doing. Kobe.